Greetings. Today, we will examine how stem cells accelerate tissue repair and wound healing. The body has a natural ability to heal itself after injury, but this process can be slow or incomplete in cases of severe damage, chronic wounds, or underlying health conditions. In fact, all healing and repair are functions of the body's stem cells, which decline in number and function as we age. Stem cell therapy has gained major attention in the field of regenerative medicine for its potential to accelerate tissue repair and improve wound healing by supporting the body's natural recovery mechanisms. For many years, it was believed that adding exogenous stem cells would directly lead to tissue repair. We now know that these exogenous stem cells from outside the body instead help to activate and reinvigorate your existing stem cells to do the repair work. Think of exogenous stem cells and related products as powerful signaling molecules versus miracle healers. As wonderful as they are, their benefits will be limited by poor nutrition, lack of proper exercise, and attention to the other pillars of health. If we haven't met already, I'm the digital avatar of Dr. Max McLeod, also known as the Nutrition Ninja Doc, founder of MyBodySymphony.com and the STEM Region/Age Reversal Technology Center, CARTC.health. He is a problem solver with a focus on helping people overcome their health challenges and achieve their health, performance, and appearance goals. He is using this avatar to save time making videos that can be better spent helping people. My role as his avatar is to convey his knowledge and insights about health, healing, and regeneration. Please realize that I'm an avatar of a doctor, and none of what I convey should be considered medical advice. It is for educational and entertainment purposes only. Consult your trusted healthcare provider before making any significant changes to your health regimen. Doc Max also provides individual supervision, in person or virtual. Contact us at 941-806-5511 to learn more. Now let's get back to today's topic. Before that, I ask that you leave a like on this video if you find it helpful. And if you haven't already done so, please hit that subscribe button because it goes a long way to help get these health-related presentations out to more people. Wound healing is a complex multi-step process involving inflammation, new tissue formation, and remodeling. When this process is disrupted due to poor circulation, diabetes, aging, or repeated injury, wounds may heal slowly or not at all. Chronic inflammation and reduced cell activity are common factors that delay recovery. Stem cells are unique because they can transform into different types of specialized cells and release healing signals. Rather than simply replacing damaged tissue, stem cells help create a supportive environment that encourages natural repair. They interact with surrounding cells, blood vessels, and immune cells to coordinate the healing process more efficiently. Stem cells may enhance tissue repair and wound healing in several key ways. Cell regeneration support. Stem cells can develop into skin, muscle, or connective tissue cells, helping replace damaged or lost cells. Reduction of inflammation. By regulating immune responses, stem cells may reduce prolonged inflammation that slows healing. Improve blood vessel formation. Stem cells release growth factors that encourage new blood vessel development, improving oxygen and nutrient delivery to injured areas. Activation of local cells. They stimulate nearby cells to divide and repair tissue more effectively. Enhanced collagen production. Stem cells may support the production of collagen, which is essential for strong, healthy tissue repair. Chronic wounds such as diabetic ulcers, pressure sores, and non-healing surgical wounds are particularly difficult to treat. Stem cell-based approaches are being studied for their potential to restart the healing process by restoring proper blood flow, reducing inflammation, and promoting tissue regeneration. Research into stem cell-assisted wound healing continues to grow, with many studies showing encouraging results. However, outcomes can vary based on wound type, patient health, and the source of stem cells used. Standardized treatment protocols and long-term data are still being developed. Stem cell therapy should always be conducted under medical supervision and in accordance with regulatory guidelines. Stem cells may play an important role in speeding up tissue repair and wound healing by supporting regeneration, improving circulation, and reducing inflammation. While not a guaranteed solution for every wound, stem cell-based treatments represent a promising advancement in regenerative medicine. Continued research will help define their role in future wound care and tissue repair strategies. As always, please feel free to contact us to explore the possibilities of regenerative medicine and stem cell therapy. Call 941-806-5511.